Have you noticed that your desire has quietly disappeared? That your mood swings without warning? Or that you wake up at 3 in the morning and simply cannot fall back asleep, and you have told yourself it is just age? I want to stop you right there, because what I am about to share in the next few minutes might be the most important video you watch this year. Today, I am walking you through 3 silent hormonal signs hiding behind exactly those experiences, and I need to warn you in advance about the second one specifically, because it is the sign that almost every woman over 60 completely misreads, and misreading it sends her down the wrong path for months, sometimes years, before anyone catches what is actually happening. I am Dr. William Harrison, and I have spent more than 20 years specializing in women's intimate and hormonal health after menopause. And I need to tell you something clearly, right at the start, because I have watched thousands of women carry an unnecessary weight of guilt for years. If your intimate life has quietly faded after 60, it is not because you stopped caring. It is not because you stopped loving your partner, and it is absolutely not because something is wrong with who you are as a woman. In the overwhelming majority of cases, it is because 3 specific hormonal shifts are happening silently inside your body right now, and nobody has connected the dots for you. Today, I am going to connect every single dot. Before we go further, I want to know where you stand. If you have noticed any of these 3 signs and brushed it off as simply getting older, write "raising my hand" in the comments below. I read every single comment. And if you want honest, judgment-free information about your body after 60 every week, subscribe now so you don't miss what's coming. Let me tell you about Patricia. Patricia is 63 years old, married for 38 years to a husband she describes as her best friend. When she came to my clinic 8 months ago, she did not come in for what we are discussing today. She came in because she was exhausted, irritable with her grandchildren in a way that frightened her, and sleeping terribly. It was only when I asked one specific question, a question almost no general practitioner ever asks, that the real picture emerged. I asked her, "When did you last feel genuine desire, even a flicker of it?" She paused for a long time and said, "I honestly cannot remember, maybe 2 years." Patricia assumed this was simply what happens to every woman eventually, an inevitable fading she had to accept. What she did not know, and what almost no one had told her, is that her blood work revealed all 3 of the silent signs I am about to walk you through today, happening simultaneously, compounding one another, and almost completely treatable. Here is why this matters more than most women realize. Your hormones do not operate in isolation. Estrogen, progesterone, and testosterone work together like 3 musicians in an orchestra. When even one instrument falls out of tune, the whole piece sounds wrong, even if you cannot immediately identify which instrument is the problem. After menopause, all 3 of these hormones decline, but they do not decline at the same rate or in the same way, and that mismatch is exactly what creates the 3 silent signs we are covering today. Let's walk through them one at a time, because each one is a clue, and together they form a complete picture of what is actually happening inside you. Sign number 1. A flattening of desire that feels less like loss and more like absence. I want you to notice the specific language here because it matters clinically. Most women describe this not as, "I used to want intimacy and now I actively don't," but rather as, "the thought simply never crosses my mind anymore." That distinction is significant. This is not depression, and it is not necessarily a relationship problem, although it often gets blamed on both. This is testosterone, the hormone most people associate exclusively with men, but which plays an enormous role in female desire, motivation, and even confidence. After menopause, your ovaries and adrenal glands produce significantly less testosterone, sometimes dropping by half or more compared to your 30s and 40s. Think of testosterone as the spark plug in your car's engine. Even with a full tank of gas, even with a healthy engine, without that spark, the car simply does not start. Many women in this situation are told they are simply not in the mood lately, when in reality their spark plug has quietly gone weak, and no amount of romantic effort from a partner can override a genuine hormonal deficit. Sign number 2, and I want you to lean in close for this one, because this is the sign that 90% of women completely misread, and misreading it sends them down the wrong path for months or even years. Unpredictable mood shifts that feel disconnected from anything happening around you. Most women, and frankly most doctors, label this as stress, or aging, or just menopause, in a vague, dismissive way that explains nothing useful. But here's what is actually happening physiologically, and once you understand this mechanism, you will never see your own mood swings the same way again. Progesterone has a direct, measurable calming effect on your nervous system because it converts into a compound that interacts with the same brain receptors targeted by anti-anxiety medications. When progesterone drops after menopause, and it often drops faster and more dramatically than estrogen, your nervous system loses its natural calming agent. This is not a personality change. This is not you becoming a harder person to live with. This is a measurable neurochemical shift, and it explains why so many women feel irritable, weepy, or anxious for what seems like no reason at all. Here is the part that almost nobody connects, and it is the entire reason I told you to pay close attention to sign number 2. This same progesterone decline directly sabotages your intimate life in a way completely separate from desire itself. Even when a woman still wants connection, even when sign number 1 is not present at all, a dysregulated nervous system cannot relax enough to allow arousal to build. Arousal physiologically requires your body to shift out of a stress state and into a parasympathetic, rest and digest state. If your nervous system is chronically activated because progesterone is no longer providing its natural buffering effect, your body remains in a low-grade fight-or-flight pattern, and pleasure simply cannot fully arrive, no matter how willing your mind is. This is why so many women say some version of, "I want to, but my body just won't relax into it," and they have no idea the sentence is describing actual neurochemistry, not a personal failing. Sign number 3. Sleep that feels broken in a specific, recognizable pattern, falling asleep without difficulty but waking consistently between 2 and 4 in the morning, wide awake, often with a racing heart or mild warmth. This pattern is not random insomnia. This is a direct signature of fluctuating estrogen, specifically the overnight drops that disrupt your body's temperature regulation and your natural sleep architecture. Estrogen helps regulate serotonin and the deeper stages of sleep, and when it fluctuates overnight, your body briefly jolts toward a lighter, more alert state. Here is why this matters for everything we have discussed. Chronic sleep disruption depletes the very testosterone we discussed in sign number 1, because testosterone is produced predominantly during deep sleep cycles. It also worsens the nervous system dysregulation from sign number 2, because a sleep-deprived nervous system has even less capacity to shift into that calm, receptive state arousal requires. These 3 signs are not 3 separate problems. They are one interconnected hormonal pattern, each one quietly making the other 2 worse, which is exactly why so many women feel like they are fighting an invisible, multiplying problem rather than one clear, nameable issue. Let me address a few questions I know are forming in your mind right now, because I would rather answer them directly than let them sit there unspoken. Is it possible to have only one of these 3 signs and not the others? Absolutely, and that is actually useful information for your doctor, because the specific combination you have points toward which hormone is shifting fastest. Could this simply be stress or a busy life rather than hormones? It is worth ruling out, certainly, but here's the distinguishing feature I tell my patients to watch for. Ordinary stress tends to fluctuate with your circumstances, easing on vacation, worsening during a hard week. Hormonal signs tend to persist with a stubborn consistency regardless of what is happening around you, which is often the clue that something physiological, not circumstantial, is driving it. Is it too late to address this if it has been going on for years, even 5 or 10 years? Not at all. Patricia had been living inside this exact pattern for roughly 2 years before we intervened, and the hormonal systems we are discussing remain responsive to treatment regardless of how long the pattern has been present. The body does not have a closing window on this kind of repair. I know some of you are recognizing 1, 2, or even all 3 of these signs in your own life right now, and I want you to feel something very specific in this moment. Relief, not alarm. Relief because these patterns are remarkably well understood medically and remarkably responsive to the right interventions. Patricia, the patient I mentioned earlier, had blood work confirming low testosterone, low progesterone, and fluctuating estrogen. Exactly the trifecta we just walked through. We addressed her sleep architecture first, because it is the foundation everything else rebuilds on, then supported her nervous system regulation, and finally addressed the testosterone component directly. 10 weeks later, she sent me a message that simply said, "I slept through the night for the first time in 2 years. And last week, for the first time in longer than that, I actually wanted to be close to my husband. I didn't have to talk myself into it. I just wanted to." That is not a coincidence. That is exactly what happens when you address the root pattern instead of treating 3 separate, disconnected symptoms. So what should you actually do with this information? First, and this is non-negotiable, ask your doctor specifically for a full hormone panel that includes testosterone and progesterone, not just estrogen. Most standard menopause blood work only checks estrogen and FSH, completely missing the other 2/3 of this picture. You may need to specifically request this, and that is perfectly reasonable. Second, pay close attention to your sleep pattern for the next week, simply noticing whether you wake consistently in that 2 to 4 a.m. window, because this single piece of information gives your doctor an enormous clue about which hormone is fluctuating most. Third, stop attributing every one of these experiences to just getting older, as if that phrase explains anything medically, because it does not. Age is a number. These 3 signs are physiological events with identifiable causes and, in the vast majority of cases, identifiable solutions. Let me give you a realistic sense of timing, because I never want to promise something that does not hold up in real life. In the first 1 to 2 weeks after you start tracking these patterns and discussing them with your doctor, most women simply gain clarity, the relief of finally having language for what they have been experiencing. Once blood work comes back and any intervention begins, whether that is a targeted supplement protocol, lifestyle adjustment, or hormone therapy your doctor recommends, the sleep pattern in sign 3 is often the first to shift, typically within 3 to 4 weeks, because it responds quickly to estrogen stabilization. The nervous system regulation in sign 2 tends to follow around the 6 to 8 week mark as progesterone-related calming effects rebuild gradually. Desire itself, sign 1, is usually the slowest to return, often 8 to 12 weeks, because testosterone-driven motivation rebuilds on top of the other 2 systems stabilizing first. This order matters. Trying to force desire back before sleep and nervous system regulation improve is, in my clinical experience, the single most common reason women feel like nothing is working even when they are doing everything correctly. Address the foundation first, and the rest tends to follow in its natural sequence. I want to be completely transparent about one more thing. Recognizing these 3 signs is the first step, not the final destination. In upcoming videos, I am going through the specific, natural protocols for rebuilding each of these 3 hormonal pillars step by step, including exactly what supported Patricia's recovery and how women without access to hormone therapy can still see measurable improvement through targeted lifestyle interventions. If any part of today's video felt like it was describing your own experience with uncomfortable accuracy, that is exactly the audience this channel exists for. Before you go, I want you to do 3 things. First, leave a comment telling me which sign you recognized most clearly, just the number, 1, 2, or 3, because this single piece of information helps me create exactly the right follow-up content for this community. Second, if this video gave you language for something you have felt for years but never had words for, share it with a friend who has been quietly struggling with the exact same thing and blaming herself for it. Third, subscribe to this channel and turn on notifications, because next week I am walking through the exact natural protocol for rebuilding each of these 3 hormones, starting with the one that resolves the fastest. I will leave you with this. You did not lose your desire, your stability, or your sleep because you failed at something or because your body simply gave up on you. 3 specific hormones shifted, quietly and invisibly. And now you finally have the map to understand exactly why. That map changes everything, because you cannot fix what you cannot name, and today, for the first time, you have the names. I am Dr. William Harrison, and I will see you in the next video.